Hi, my name is Dr. Shawn Hirsch. I'm a licensed psychologist, board certified in clinical child and adolescent psychology. I've been doing diagnostic evaluation and intervention for people with autism and their families for over 20 years now. The biggest myth about autism right now is that people think they understand it because of social media. And we actually have research on this. Studies looking specifically at autism content on TikTok found that nearly 3/4 of informational videos are either outright inaccurate or so overgeneralized that they're misleading. And the troubling part is that the algorithm doesn't really care if something's true or not. What that has created is a public narrative about autism that's frankly pretty far from clinical reality. The autism that gets clicks and followers tends to look a specific way. Highly verbal, high IQ, socially awkward, in an endearing way, maybe a special interest that comes across as charming. That's a real presentation, but it's just one slice of an extraordinary heterogeneous condition and population. And while that slice is dominating the cultural conversation, the people who are nonverbal, who have significant intellectual disabilities, who need more intensive support across their entire life, those people and their families are becoming less seen at exactly the moment that they need the most advocacy and resources. The second myth, and this might be more insidious, is that autism is essentially just a different way of being. Personality style, a quirk, something that just needs acceptance in a sensory-friendly environment. And I want to be careful here because acceptance matters, accommodation matters, and the neurodiversity framework has genuinely helped a lot of people. But when we reduce autism to quirkiness, we're doing a disservice to people for whom autism means something categorically different. Families who are exhausted, who are navigating systems that were never built for their kids, and who don't see their reality anywhere in the conversation. So the myth isn't just wrong, it's a wrong picture, and wrong pictures have consequences. The honest answer is that autism looks extraordinarily different from one person to the next. And that's both true and frequently misused. Yes, it's a spectrum, but spectrum doesn't mean a straight line from a little autistic to very autistic. What it actually means is that the core features, difficulties with social communication, restricted and repetitive patterns of behavior, show up differently in different people, in different combinations, and at different levels of severity. Clinically, we talk about this in terms of levels of support. Someone at level 1 may be intellectually gifted, verbally fluent, holding down a job, and yet still genuinely struggling. Difficulty with reading social nuance, making a lot of social errors, rigidity that creates real problems in relationships and workplaces. That's real, and it deserves support. Level 3 looks completely different. Someone who may be minimally verbal, who has significant intellectual disability, who needs intensive support for basic daily functioning across their entire lives. These are not points on the same slider, they're profoundly different lived experiences that happen to share a common diagnostic label. But here's what I want people to hold on to, and this is important. Across all of those presentations, the core deficit is in social communication. It's not shyness, not introversion, not social anxiety. The specific difficulty in understanding, developing, and maintaining reciprocal social relationships. That thread runs through all of it. And that's what makes it autism rather than something else. When that thread isn't there, we should be asking harder questions about what we're actually looking at. This one comes down to basic neuroscience. Autism is a neurodevelopmental disorder, meaning that it's not something that someone develops in response to life experience. It's present from very early in development, likely before birth. And the brain in early childhood is doing something that will never ever do again. It's in a period of extraordinary plasticity. The architecture of the brain is being built and connections are forming at a rate that will never be replicated throughout your life. What that means practically is that intervention during that early window works differently than intervention later. We have robust evidence that intensive early developmental and behavioral intervention, particularly in those first few years of life, can meaningfully change trajectories. Not cure, not erase, but genuinely shift outcomes in communication, adaptive functioning, and quality of life in ways that become much harder to achieve later. The brain is just simply much more responsive to that kind of scaffolding early on. There's also a systemic reality that families need to know. The service infrastructure for children with autism, these early intervention programs, these school-based services, federally mandated supports, is substantially more robust than what exists for adolescents and adults. Identifying early means that accessing this infrastructure while it's most available and while the child is most neurologically receptive is important, because waiting costs something real. And for families, early identification means early understanding. One of the most painful things that I see clinically are families who spent years being told their child was just difficult, immature, or that they were overreacting to what they were seeing. A diagnosis isn't a limitation, it's an explanation, and it opens doors rather than closing them. I want to answer this carefully because I think that the way we talk about autistic strengths has itself become a little bit of a myth. There's a cultural narrative that autism comes with compensatory gifts, exceptional memory, mathematical ability, pattern recognition, or some special talent that balances out all the social difficulties. And for some people, that's genuinely true, but it's not reliably true, and it's not true in proportion to the way that it dominates the conversation. When we lead this strengths conversation with savant narratives or Silicon Valley genius stories, we're telling a small slice of the population's story and implying that it applies to everyone. And for families supporting one of their children with profound autism, that narrative can feel very alienating. That said, there are real things worth naming. Many autistic individuals bring a quality and depth of engagement to their areas of interest that is genuinely remarkable. Not because autism gives them a superpower, but because when something captures their attention, it captures it completely. There's often a directness, an honesty, and a resistance to social performance that people around them find, once they understand it, refreshing and trustworthy. Also, many autistic people have a strong commitment to rules, fairness, and consistency that makes them extraordinarily reliable in the right context. But I think the most overlooked strength is actually resilience. Most autistic people, particularly those who have gone unidentified or under-supported for years, have been navigating a world that wasn't designed for them, often without a map, often without anyone around them understanding what they were experiencing. That takes something, and we don't talk about that enough. The reframe that I'd offer is this. Instead of looking for the special talent, ask what this particular person is good at. What engages them? What conditions let them function at their best? That's a more useful question than hunting for the gift that supposedly comes with the diagnosis. The most important shift in how we've come to understand autism is that we stop tying the diagnosis to intelligence and language level. For a long time, there was an implicit assumption that autism looked a certain way. Nonverbal or minimally verbal, intellectual disability, and significant behavioral challenges. If you didn't fit that picture, you either didn't get identified or you got told you couldn't possibly be autistic because you were too articulate, too communicative, or too academically successful. That was genuinely harmful and left a lot of people without explanation or support for a long time. What research has clarified is that the core deficit, the specific difficulty in reciprocal social communication, is present regardless of IQ or language level. A verbally fluent, intellectually gifted person can have profound difficulty with the actual back and forth of human relationship. And critically, those difficulties are observable and measurable when you know what you're looking for. The packaging may look different, but the underlying mechanism is the same, and a trained clinician can find it. This was a real and important advance, but it also requires clinical skill and not a checklist. And I think that we're at a moment where the field is having an honest reckoning. When we broadened the diagnostic criteria for autism in 2013, we also lost some precision with it. The concept of a spectrum was originally meant to capture meaningful variation within a clinically coherent condition. Over time, and especially as social media accelerated public awareness, the boundaries of that concept have been stretched considerably. Some of the most respected researchers in the field are now asking very hard questions about whether the spectrum has become so broad that it's losing diagnostic utility. Whether we've conflated genuine autism with social anxiety, with personality variation, with the normal range of human differences is the question. Now, that's not a reason to panic or dismiss anybody's experience, but it is a reason to take diagnosis seriously, to insist on a rigorous clinical evaluation rather than self-diagnosis from a checklist, and to make sure that while we expanded the tent for people with autism, we haven't inadvertently made it harder to see the people who need the most support. The honest answer is that our understanding has genuinely improved, and we're honestly still working on getting it right. The first thing to understand about support is there's no universal answer, and anybody who tells you that is trying to sell you something. What support looks like depends enormously on where someone falls in terms of their needs, their age, the environment that they're in, and what they're trying to accomplish. So let me try to give you a real picture across that range. For young children, the evidence points clearly towards intensive early intervention, applied behavior analysis, naturalistic developmental behavior interventions, speech and language therapy, and occupational therapy. These can help build the foundational communication and adaptive skills that everything else in life depends on. This is resource intensive, as it requires many hours per week, specialized providers, and families who are essentially the case managers for their own children. It's hard and it is necessary. For individuals with less intensive support needs, and this is a large and growing part of the clinical picture, support looks different. It's often about helping someone understand their own profile, why social situations so often don't work out, and why they feel exhausting in ways that they simply don't for other people. How to advocate for themselves in an academic or workplace setting, how to navigate relationships with more explicit understanding of the things that neurotypical people absorb implicitly. And vocationally, the needs vary just as much. Some people need structured job training and supported employment. Others are highly capable in their field and primarily need reasonable accommodations, like a quieter workspace, clear written communication, flexibility around social demands that aren't actually relevant to job performance. And often the biggest barrier there isn't the person's capability, it's workplace culture that hasn't caught up. But here's the thing that doesn't get talked about enough. There's a cliff. In the United States, when a young person with autism ages out of school-based services, the service infrastructure largely disappears. The elaborate IEP, the team of providers, the legal entitlements, gone. What replaces it for adults is very fragmented, underfunded, and in many states has waiting lists measured in years. I see this in my practice constantly. Families who fought so hard and did everything right, and then their child turns 22, they're essentially on their own. That's a systemic failure and deserves to be named as one. Advocacy starts with understanding the systems that your loved one is embedded in, and those systems change at different stages of life. For school-age children, the most important thing a family can do is to understand their rights under IDEA, the Individuals with Disabilities Education Act. Every child with autism is entitled to a free and appropriate public education with an individualized education program. That IEP is a legal document. Families have the right to participate in developing it, to challenge it, and to request independent evaluations if they disagree with the school's assessment. Now, as a young person approaches adulthood, families may need to consider thinking about guardianship and supported decision-making before they need it. At 18, legally your child is an adult. If they have significant cognitive or adaptive limitations, that transition can create real practical problems. For these parents that have been managing medical care, finances, major decisions, suddenly have no legal authority to do so. And it should be noted that there are different levels of guardianship, from full to limited, and newer frameworks around supported decision-making that preserve more autonomy for the individual. It's not a fun conversation to have, but waiting until a crisis forces it is far worse. But here's the advocacy point that I feel most strongly about, and I want to say it clearly. The single most damaging thing that I see in well-meaning families, educators, and clinicians, what they do is lower expectations without clinical justification. This comes from a really good place. They want to protect the child from frustration, from failure, from pain. But what it communicates over and over is that we don't believe that you can. Every autistic person, regardless of support level, has the capacity to learn and to grow. The goals, the timelines, the support required may look different, but the expectation that growth is possible should never be arbitrarily removed. Some of the most meaningful clinical work that I've done has been with adolescents and adults who, when given the right support and the right belief in their capacity, did things that nobody predicted. And that happens more than people think. And it starts with someone refusing to lower the bar. What I want the public to understand is that autism is not a metaphor. It's not a personality type. It's not a brand identity. And it's not something that you diagnose yourself with after watching some TikTok or Instagram videos. It is a neurodevelopmental condition with real complexity, observable impairment, and real consequences for the people living with it and the families supporting them. At the same time, And I want to hold both of these things simultaneously. People with autism are not defined by their diagnosis. They are whole people with capacity for growth, for connection, for meaningful lives. The goal of everything that we talked about today, early intervention, appropriate support, honest advocacy, realistic expectations, is not to fix something that's broken. It is to give people what they need to become who they are and desire to be. All of you out there can help by demanding better information, by being skeptical of what you see on social media, and making sure that in all the progress that we made around awareness and acceptance, we don't lose sight of the people who need the most from us. Because right now, honestly, we're at the risk of doing exactly that.